You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments, according to my first guest. With us, we have Dr. Magathan. Dr. Magathan, welcome to the program.
Thank you, Randy.
Now, for people that don't know you, because you do more than just dental implants for denture wearers, who is the typical patient and, what are the different procedures you do in your practice?
I'm a general dentist, and I have a clinic in Edmonton, and I do all kinds of procedures. I do children, crowns, veneers, dental implants. We also have a machine that makes crowns in a day. It's called CEREC, and it's CAD/CAM technology.
Is that popular, by the way?
It's very popular, but you can come in, you can get your tooth crowned and walk out with your brand new CEREC porcelain crown all in one day.
Okay. Is that how it's normally done, by the way, in Canada? Because here in the U.S., we send it out to a lab.
Yes.
I guess a few dentists have this.
Well, no, you can do both ways, but for the most part, you can do it this way, but it doesn't fit all circumstances. We do other kinds of crowns too, but it's there when we need it.
Sounds like
and
pretty
it's
convenient,
beautiful.
right?
Yes, it's very, very hard.
Because people don't like going to the dentist, right? Saves them a trip. Do you hear that still?
Oh, yeah.
No offense, doctor?
No. Lots of people don't like going to the dentist, especially a lot of my patients, because they're really nervous. So
you have a slogan, I read it. I like to see my patients smiling when they arrive and when they leave. Elaborate on that. Yeah. Why you wrote that.
Yeah, Randy, the reason I say that is because a lot of people don't have the opportunity to find someone that can do anesthesia for them. So my patients are really happy to find me. And what we do is we take that very nervous patient and take care of them. They're
scared, really?
They're really scared. Very, very scared.
Like you have to meet them in the parking lot sometimes?
Well, sometimes we do. We have to talk with them ahead of time, sometimes out in the hallway, and I talk them into coming into me. I say, I'm not going to look. I'm just going to talk today. I'm not going to stick pokey things in your mouth. We're just going to have a conversation and talk about what you want, why you're here, and then we're going to go from there. And we're going to talk about how we can take care of that phobia. And in the end, if we can have them happy and walking, and they all often walk out with a smile.
So future visits,
yes,
they start coming in, they're smiling.
Yeah, they're smiling.
Like your slogan says.
Yes, yeah. And even smiling out the door because they know there's a way to get taken care of.
So you get a lot of referrals from other dentists because you're a dental anesthesiologist, is that right?
I've been doing IV sedation for 20 years. It's amazing. Patients love it. They can come in, they can take care of their fears, they can, if they're busy, if they have not enough time, if their children are too young, if they have disabilities, we can take care of them with IV sedation, whether it's a light sedation or a deep sedation, whatever you require. If you're nervous about needles, we'll even put cream on so you don't feel the needle. We can take care of your fear and give you an IV sedation.
Let's talk about your training, because today's topic, I made a bold statement at the top, that according to you, that people that are wearing dentures could go into your office and leave with a full arch of teeth. Yes. Is that right? A fixed set of teeth?
Yes, we can do that. We have a lot of patients that have, let's talk about patients that have teeth that are very, very nervous. A lot of these patients have come in, they've had a lot of pain, they have a lot of broken down teeth. Sometimes they only have their front teeth, they've lost their back teeth. They don't want to smile because their teeth doesn't look very good. Well, and they come to me because they have these dental problems and they have these fears. One of the fears is that they have fear of the pain of going to the dentist, but the other fear is fear of having to wear a denture.
Okay.
So they come to me and I talk to them about their options, whether we can do all those things, but they have to come and see me every 3 to 4 months for cleanings, and that means coming back to me and maintaining everything. But what we can do is we can take the teeth out, place implants, and give them a beautiful set of teeth, and they can do that all in one day. They can walk out and they can have teeth, and they can smile, feel good, chew, laugh, eat, swim, whatever they want to do, because their teeth aren't going to fall out, and they're very, very happy.
Now, for the denture wearers,
yes,
how big of a problem is it where you are? Like within an hour of your practice, would you say, there's a lot of people wearing dentures?
Oh, there's a lot of people.
Like thousands?
Oh, Randy, studies show that actually people over 65, 50% of them are wearing dentures.
Interesting.
Yeah, that's a lot of people wearing dentures. And so a lot of those people don't really realize that their options are to have a fixed set of teeth, because most denture wearers don't go to the dentist. So they're not hearing about the options for what options they have as a denture wearer.
So there's a lot of people wearing dentures.
There's a lot of people wearing dentures.
And they just don't know their options because, like you just said, they don't go to the dentist.
No, and sometimes when
what if you're too old, though?
No, that's
like
no.
What if somebody's been wearing dentures like 30 years? Isn't it true, though, they lose too much bone?
Yes, but a lot of the procedures we do now, what we do is we place the implants where the bone is. They're angled. We secure it all with a denture, and they walk out with teeth. It's graftless. We don't have to go in and do a bunch of surgery. And
what are the age ranges of these patients?
well, there really is no age range except for being an adult. If
Okay.
you were a teenager, you have to stop growing. But I placed an implant on my 80-year-old mother. And
Oh,
you
really?
can, yeah.
Why would she want to do that at that age?
Well, why wouldn't she? She likes to smile. She wants to have a beautiful teeth. She had
Okay.
to lose a tooth, and it's right there. And I said, Mom, let's put an implant in there.
But if they're 80 years old, is it more likely the implant will fall out?
No, we have the bone, we place the implant in there, and that's, once we place an implant in there, it's going to stay. Now, with implants, we need to have osseous-integration.
What does
and
that mean?
That means what happens when we put an implant in there, first of all, we put an implant in there, we get this mechanical stability, means it holds on. But what we want is osseous integration, which means the bone goes, I like this, I want to fuse onto this. When that happens, that implant is like bone.
How long does that take?
3 months.
Oh, good.
Yeah.
Okay.
And
Why
that
is it-
happens.
Why is it, by the way, what used to take like 9 months or so now can happen so quickly, like in a visit or two?
Well, there's a lot of things that have changed in dentistry. We used to go from 2 stage to 1 stage, where we used to go place the implant, and then we had to wait 3 months, uncover the implant, then put a little healing abutment on, then come back for an impression, then come back for the crown. 4 appointments. Now we've gone.
And that was over maybe half a year,
Yeah, that
a
was
year?
over half a year because we thought we had to let things settle. Now what we do is we've gone from 1 stage where we can actually put the implant in and wait the 3 months, and then we can put a tooth on it. We've even gone farther than that, Randy, where we can actually take a tooth out, put the implant in, and if the circumstances are great, we can put a crown on it. And you can walk out that day with a broken tooth and walk out with a brand new tooth.
Okay.
And we have to let it sit for 3 months before we can give you
But
a
how soon
final.
do they eat, though, by the way?
They have to eat soft foods.
Are they left without teeth for 3 months?
No.
Oh, so
they
they're
have a
never left
tooth.
without teeth?
No, we don't like to leave people without teeth. Our goal is to
Okay.
have people walk in and walk out with a set of beautiful teeth. Not a denture, not a flipper when you have an implant,
Okay.
teeth.
Okay, so if it's as good as you say it is, though, and if there's tens of thousands of people near where you are with an upper or lower denture,
Yeah.
why aren't they all doing it? Sounds
Well-
like they'd be lined up to do it. Respectfully, I say.
Well, a lot of them don't realize that, one, a lot of these patients don't go to the dentist, so they don't know about it, and a lot of times they're told they can't do it because they don't have bone or they don't have enough, there's
You mean
sinuses
other
in there.
dentists will say you don't have
Well,
enough bone? Has that happened
Yes,
in your office?
yeah, it's because that is what happened. That's another way of doing things is placing the implants straight. You need to have bone there. Now we're angling them, so we're putting the implants where the bone is. So yes, that option is there, but not everybody knows that. A lot of people think that they're too old, but really, Randy, age doesn't matter. If you've got good bone, even if it's a little bit of bone, we can find that bone, place the implants in, and give you a beautiful set of teeth. So it doesn't matter. If you're 90-year-old, I've placed implants on a 90-year-old.
Really?
Front tooth, needed to have an implant, 90 years old. I took the tooth out, we placed an implant in, and I put a temporary on, and he walks out with his tooth.
It seems like it hurts.
90 years old.
But it seems
doesn't
very
hurt.
painful.
No, that's one of the biggest misconceptions about dental implants is fear of pain. Pain, the bone doesn't have any nerves. The gum is where and the tooth is where a lot of those nerve fibers are. So when we place a dental implant, it's a very, very controlled procedure. We take make a little tiny incision, open up the gum, we place the implant in the bone, and we close it up again.
So the pain of the past was the gums.
Pain of the past
So it's very little surgery now?
Yeah, the pain of a lot of the thought of getting implants in the past was the surgery, having implants, grafting, hip, sinus lifting, all those things, which sometimes we have to do, but those things don't necessarily, don't have to do that with everybody. Another reason why they're not coming in is because they have these memories, Randy, of going to the dentist, having pain, having broken down teeth, bad smell in their mouth, not happy smile. A lot of these patients don't realize that they're thinking they have to have a lot of surgery and a lot of what they had been through in the past to get a fixed set of teeth. They don't realize that they can actually come in, we do minimal non-invasive surgery, gentle surgery, and they walk out with a set of teeth.
Okay. What are the categories of dental implant patients that you see?
Well, dental implants are for single implants, if you're single missing tooth. You can have it for multiple missing teeth. A lot of these patients, they have teeth and they don't know their options. they're thinking that what they have to do is they have to get all these teeth restored, come down on a regular basis, get everything crowned and root canaled, and see the periodontist and get something in the back to chew on. They don't realize that really they can have their teeth out and can have a beautiful set of teeth and have a beautiful smile, be able to chew.
What if they have bad gums, though? I mean, these people with really broken down teeth, bad gums.
Well,
In fact, I was told personally, because I heard about dental implants. I told a friend of mine, my wife's friend, when I get dental implants, oh, my gums are bad.
yeah, a lot of people think that the gums actually stay. Once you lose the teeth, the periodontal disease goes away. When we take
and the gums get healthy?
The gums get healthy. The gums get
so
beautiful.
When you extract the
Yes, we take the tooth
Interesting.
out. The gums are beautiful. So what we want to do is, we don't want to function on gums. It's like jumping on a cushion, right? Dentures like bouncing up and down. We want to fix everything so you can chew on a steak, on a corn on the cob.
Can they?
Can they? Of course they can. Once.
Do they tell you? Do they ever tell you stories of what they've eaten?
Yeah, Randy, I have a lot of patients that come in, they go to the restaurant before when they had dentures and they had to choose soft things off the menu. Everybody else is having a steak, they're in a steakhouse and they have to have pasta. Now they can go and they can have anything they want. They can have the steak, they can have the big Albertan barbecue with Alberta beef, the big steak, the corn on the cob. They can do that and feel comfortable. They're not going to worry about their teeth falling out.
How important, because we've talked on the phone and you've talked about the self-esteem part of this. How important is the smile?
Smile is very important.
Well, you're a dentist, of course I knew you were going to say
Yeah.
that, obviously.
Well, it's confidence. If you can't smile, you don't have the confidence to feel good about yourself. If you can smile, you can feel good. And when you want to feel good, then you want to look good and you want to go out there and take on whatever makes you feel great. So there's a big psychological component of it. Being able to smile, being able to know that your teeth aren't going to fall out when you smile, or if you cough, your teeth are going to fall out, or if you're sick, you could.
Are there ever tipping points where a denture wearer comes in and on the consult, like something happened and they said, I got to do something about this?
Oh yeah. I've had patients come in. I've had patients come in that were nervous, and I've had their spouse come in that's wearing dentures, and I'm talking to my patients about what their options are, and the spouse is listening, and I'm going, okay, this is where you are in a denture. This is where you could be. You can walk out right now with your denture, come in with your denture and walk out with a fixed set of teeth. And so I've got both of them there listening to me, and they don't know it's available. And
well, who would say no to that?
Well, who would say no to that?
It's just a matter of...
That's quality of life. There's needless years of suffering when you have a denture.
And insurance doesn't cover this in Canada. It also doesn't cover it here. Is that correct? I mean, we know it doesn't cover it here in the U.S.
No, it doesn't cover it.
But you have
some
financing
insurance
available?
covers it.
Okay.
Dental insurance in Canada do cover some implants. They do cover
a portion of the cost.
Portion of the cost.
Okay.
They cover, yeah, they'll cover the portion of the cost.
Now, something you do, I guess it's very unique, is how it's normally done. They go to a surgeon for one thing, another dentist to put the teeth on top, and then they go to an imaging center. You do it all right there. Elaborate on that. Tell me the process.
Randy, how it's done a lot of the times is the dentist will come and they'll make a plan. They'll send it out to have the implant done by a surgeon. Then they'll come back 3 months later and have the crown placed.
So the patient goes to the surgeon, gets the implant placed.
Right, yeah. And sometimes they have to go out for special imaging.
Okay.
In my clinic, I make the plan, we take the imaging, we look at the imaging, which is a three-dimensional model of that patient.
So you have a CT scan
I have
right there.
a CT scan. I can look at that patient's bone, look at it from all sides. I can measure, I can see where all the anatomical structures are. I can actually look at the bone, how wide, how tall, how the implant is. And then I plan the implant, I do the implant, place it all in one appointment.
So let's begin then with denture wearer goes to you on a consult. What are their options as far as dental implants?
Well, their options are we can place 2 implants, and we can place a denture in that snaps in and snaps out, but you're still wearing a denture.
So where do you put those implants?
We place them right here in the front of their mouth.
Okay.
Okay, that snaps in.
And that's a full arch of teeth?
Yes, it's a full denture, but it's attached with implants. What the implants do is actually it retains it. It's like the glue, but it's better. It's going to snap in and snap out, but you're still going to get that shifting.
Okay.
Shifting of the denture. So when we place the two implants in, we're going to snap in that denture, and they're still going to get this rocking motion.
But is it still better than
It's
having
way
nothing?
better. When you have just tissue supported and tissue retained, it's like sliding all over the place.
Now, I know a few denture wearers, and they don't complain at all about their dentures.
Well, I don't know if they would tell you, Randy, if they're having a problem with their dentures.
Okay. Good point. I guess I'm not a dentist, so they're not going to tell me. Is there such thing? Are you saying then that maybe there's no such thing as a happy denture wearer?
I think that I think a happy, no, I don't think there's a happy denture.
They just don't know what they're
I
missing?
think
They've adapted?
everybody wants to get better. Every denture wearer would rather have their own teeth back, guaranteed.
Okay.
Yeah, they would rather have fixed teeth so they can chew. They don't have to have this moving around, clanging, falling out. They can have a better quality of life. They can swim. They can kiss better. They can.
And these are things that denture wearers have to deal with.
Yeah, they have to deal with.
Interesting.
They
Good
have
point.
to deal with sore gums all the time. They have to deal with not being able to chew, shifting around. When you have a fixed set of teeth, you've got implants that are support. We're not getting the soft tissue in there anymore. It's on the implants. It's firm. You're not going to have those sore spots.
Now, but you don't necessarily like just 2 implants. You'd rather go a couple more. And I don't want to put words in your mouth, but I think you told me that.
I think that when you make the step to say, I want to have something fixed in my mouth with a denture, I think the best thing to do is go with 4. When we do 2, it's there. It's better than having no implants. But when we go with 4, we can give you it's like having your own teeth back.
So when you say all on 4, is that what we're talking about?
Yeah, the all on 4 really is just a term.
Okay.
It basically means teeth on 4 implants. You don't have to have an implant for all the teeth you have and have teeth that way. We put teeth on 4 implants and you're walking out with a set of teeth.
Is that what that is?
This is an all on 4.
You show this to people
yes,
sometimes?
I do, because you're going from this, which is a denture, to this. No acrylic on the palate. You can touch the roof of your mouth. This is a denture. Now there is.
Okay. So this is a denture,
Yeah.
obviously, but there's holes in it right here.
That is the denture that you.
Is this what it would look like? Or no? This
No.
is just an example.
This is what
Okay.
it looks like prior to fixing it in.
Okay.
Okay. So we take that denture.
So the roof of the mouth is covered.
We take your denture and we make holes in it, and we fix it to
you
the
cut
implants.
out the roof of the mouth then?
And we cut out the roof of the mouth. We cut out the roof of the mouth, we cut off the extra acrylic, and we make a denture, a set of teeth like this that's fixed. You don't take it out. You come back to the dentist a year later, maybe 6 months, to have them
So like
cleaned.
a regular checkup. Every
A
6
regular
months
checkup.
you go in.
It is. And we take it out, very simple. We clean the teeth, put it back in. It's like an hour.
When this is done, is this one of those things where the patients say, I should have done this years ago?
Yeah, a lot of patients say that.
Now your challenge though, we said at the break, that it's hard to get the denture wearers in, right? Mm-hmm. Because they're afraid of the dentist. They don't go to the dentist anymore. So, you know, I appreciate you coming on the show, by the way, to let people know their options. And the other part is because you're an anesthesiologist, for the people that are afraid, right? I know my dad, he had dental implants, by the way, as lower. Deathly afraid,
Yeah.
right? But you say, now, he wasn't IV sedated, you do IV sedation.
I do IV
Tell me about
sedation.
that process, and is it safe?
Well, Randy, I went back to university to do sedation after dentistry. So what we do in my clinic, it's an accredited facility where we get accreditation through the Ministry of Health, so it's a safe place to have anesthesia done. I give oral sedation, nitrous oxide and oral, IV sedation, and general anesthesia, whatever you need. Sometimes with children, we have to do general anesthesia. If we have a young child that's too young to have dental work done awake, I give them general anesthesia. There's some patients that might need, they need to be unconscious, they don't want to be aware of anything, or they're just a little bit nervous and they want to be relaxed. We can give them that form of sedation. Or if they don't want to be aware of anything, they say to me, when I was in the operating room, I woke up. Well, that's not going to happen. We're going to keep them right to sleep.
Tell me this, because I think you told me this. You may have a complex case come in, right?
Yes.
You have to extract all their teeth.
Yes.
They chose dental implants.
Yeah.
And when it's all done, they don't even realize it was done. Like they have no memory. Like they go, that's it?
Yeah, that happens. Last week I had a patient. We took out 8 teeth. We did the surgery. We placed the implants in, and they walked out with their teeth. And that night I gave him a call to see how he was doing. And I asked him, how he felt. He was awake the whole time, just sedated. And I said, how does it feel? And he said, I don't remember anything. I said, well, did you realize you were there for a long time and we did a lot of work? And he said, oh yeah. He said, I don't remember anything. I feel good. I don't hurt. I'm eating soft foods right now. He was very happy.
Okay. Now, to touch on, because we only have a couple more minutes left. So for people that are watching this,
yeah,
they have a mouth filled with teeth that are failing, loose, falling out.
Yeah.
Maybe they've been told by another dentist, your teeth have to go.
Yeah.
And they have a decision, dentures or something retained by dental implants.
Yeah.
What do you say to them? Because you say their gums will, are good enough for dental implants. So what do you say to them? They're skeptical. They're watching this.
Well, I talk to people, I talk to my patients and ask them where they want to go. And so I say, these are your options. We can take your teeth and try to make them better. We always try to make things better. We want them to walk out better than they walked in. So we take them, we give them their options for how to maintain their teeth. And that means coming to the dentist every probably 6 months, 4 to 6 months, and getting them cleaned. Or we can go to an option where we can actually, and they're very often very phobic, so this is a really good option for them because they don't have to visit the dentist and be terrified. We can take their teeth out, we can place these implants, we can give them a set of teeth they're going to feel good about. They're going to come in just for once a year cleanings, and they can have this beautiful smile, this functioning set of teeth that's going to make them feel good.
Great stuff. I mean, we literally are out of time, but you really feel and believe you're changing people's lives.
Oh
Good for
yeah,
you.
we're
Good for you.
changing people's lives. I have a patient of mine that has been coming to see me for years, wears a complete upper denture, and was very nervous about having this treatment done because
She had an upper denture?
she had an upper
Okay.
denture. And I said to her, I said, let's do this. She wanted to do it, so we planned it, and when she was ready, she did it. The day she came back, she says, Dr. Magathan, I have not felt the roof of my mouth since I was 16 years old. She said, you changed my life. She gave me the biggest hug. We were crying in the room because it was amazing. She's so happy, his beautiful smile. This is someone that didn't feel comfortable about going swimming. She told me that she was going to go skydiving now.
Okay.
I mean, that's what she said to me. It was amazing. Randy, I've got another patient. She came to me. She was 21 years old. You could not see her teeth. There was black everywhere. The reason she came to me was she promised her grandmother that she would come to see the dentist. She came to me because I was going to give her sedation. She had all her teeth out. We gave her a fixed set of teeth. She was extremely happy. We cried, we hugged. This is someone
Nice,
who's in her
very
20s
nice.
that couldn't smile because of the darkness, the black. She still had her braces on that you could see through the decayed teeth.
So you're used to this type of situation. As a, I guess, dental anesthesiologist,
Yeah.
you get the tough ones.
We get
You don't get
really
the easy
easy-
ones, right?
No, we get people that don't go to the dentist that are really severely broken down.
Are they ashamed, by the way?
Yeah, they're very ashamed.
And what do you say to them? I mean, they
I say, you know what? I get it. I'd come in to see me. We're going to take care of you. We're going to look. We're going to talk about it. I understand your fear. I'm going to look gently. We're going to plan it.
Great info. Final message, though. Somebody watching this, and maybe they're still afraid, even
Yeah.
though they've met you on the program, their teeth are falling out, or they're a denture wearer, and they think they're too old.
Yeah.
What do you say to them?
I'd say, come, give us a call. Call our office. Let me give you your options. Whether you have teeth that you want to save, or whether you think you're too old, or whether you have a denture and you don't know what your options are, give us a call. We'll have a chat. We'll talk about what your options are, and hopefully we'll get you walking out with a beautiful set of teeth that you can feel good about, you can smile, you can chew, and be happy.
We talked over there, and,
Yeah.
and I told you, I feel like I could spot dentures, okay? But you say they're beautiful. Those are your words.
Yeah.
Like there's a cosmetic component to this.
Yeah.
Tell me about that.
Randy, these teeth are beautiful. They are beautiful teeth. You cannot tell they're dentures. They're not dentures. They're teeth. They're beautiful. They have beautiful lip support. You don't have that big flange up there. You have the roof of the mouth. You can chew with it. They're beautiful.
And the gums? Are they
the
hand
gums,
painted?
They're they're carved, they're contoured. It's beautiful.
Okay, good. What's the favorite part about what you do? What gives you the most
I
satisfaction
love changing
these
people's
days?
lives. I do. I love changing people's lives. That's the most amazing thing. I love when someone is extremely scared, and we can give them a healthy, functioning mouth without pain. That's what makes me happy.
Final tip though, what should somebody look for in a dentist that's going to be doing their dental implants?
Experience. I think experience is really important.
You've been doing it how long?
Over 10 years.
Okay. What else?
And finding a doctor that's going to explain everything to them, giving them options. That's important.
Okay, you spend a lot of time with the patients?
I spend a lot of time with the patients.
Good.
Yeah, we develop a relationship and we talk about their options and we have a common goal and we can see it and visualize it and we go for it.
Do people like dealing with a female dentist? Because everybody's afraid of the dentist.
Well, I don't know what it's like to be a guy dentist, but
I mean, do people say, I'm glad I have a female dentist?
Yeah, a lot of people say,
Like the
especially
women?
with children, are saying, I'm glad that you're a female dentist. Because children seem to be more comfortable with a woman.
When did you know you wanted to be a dentist?
When I was in dental school, I was in university, I was doing sciences, but when I was younger, I was afraid to go to the dentist. So I didn't want to be a dentist, I didn't like it. But then all of a sudden it clicked, and I thought, that's what I'm going to do. I'm going to be a dentist. And from there on in, I just went for it.
I want to thank you for coming to the show. Very nice.
Thank you,
Very nice.
Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this, again, online, visit our website at wellnesshour.com and just put in Dr. Magathan. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.